Um, my name is Courtney Cuthbertson, and I'm a postdoctoral fellow with the CAPE project, which stands for Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. The CAPE project is a partnership between the Substance Abuse and Mental Health Services Administration, the United States Department of Agriculture's National Institute of Food and Agriculture, and the Regional Rural Development Centers. We are very pleased today to be hosting the webinar entitled A Community's Response to Reduce the Burden of Substance Abuse. And this will be presented by Melissa Daughter, who is the coordinator of the Marathon County Drug-Free Communities Program. She has extensive experience in public health and has led substance abuse prevention and coalition efforts in multiple diverse communities. So we're very excited to hear from you today.
Inviting me to be part of this discussion today. Like Courtney said, my name is Melissa Daughter, and I've been working in public health, prevention, and coalition work for over 13 years in communities of all sizes, all funding levels, all functionalities. So really I've been very fortunate to work in many different diverse communities. So I've kind of seen it all. Since 2010, I have held the position of the Drug-Free Communities Program Coordinator for Marathon County. At the time that we began, there's actually 3 different coalitions working in substance abuse prevention, including the AOD partnership. So I'm just going to share a little bit about the coalition before we get into the initiative, just so you kind of know where we came from. Prior to 2010, there's the 3 different coalitions working with substance abuse issues in our county. There's the AOD Partnership of Old, which consisted of kind of the usual suspects, what you would see in many different community coalitions. Schools, law enforcement, treatment, maybe some public health, but in UW Extension as well. This group actually held a 501c3 nonprofit status for a number of decades, but they really didn't act as one. So I'll get a little bit more into how we've used that. The second is Bravo, which stood for Building Responsible Alcohol Values and Opportunities, which actually came out of the public health CHIP processes, which is the community health improvement plan process that health departments are required to do every year. And they actually focused a lot more on social norms and a lot more towards youth. The third was our AODA steering committee, which was a lot of the government heads. It was kind of the top level decision makers, not necessarily the boots on the ground. So as a result of some stakeholder meetings, they actually came together in the fall of 2009 and decided that instead of competing for those resources, people, media, you name it, it was smart to join forces. So they came underneath the AOD partnership because it was a 501c3. We created a new group with a new logo, new mission, new website, and it had new leadership as well. So now we actually just wrapped up year 10 of the Drug-Free Communities Grant. The AOD partnership has actually grown since we came together from a few dozen to over 200 individuals and organizations working together to achieve our mission to eliminate the misuse of alcohol and other drugs in Marathon County. And for those of you that aren't familiar with the Drug-Free Communities Grant, it's actually a federal appropriation through Congress that's administered by SAMHSA. So it actually comes in 5-year increments. Our first 5 years was at our local school district. They really focused on WASA specifically. My arrow's off a little bit there, but WASA is located right in the center of the state. It's one municipality amongst a number of them within an area. And they focused a lot on the peer-to-peer mentoring, doing a lot with individuals and families, but not really a lot of community work. So in years 6 through 10, when we reapplied, they kind of felt that because we were going to do more focus with environmental strategies and policy work, that it made more sense to move the fiscal agent of that grant for the AOD partnership to the health department, and which is definitely in the wheelhouse of public health. Because the 2 goals of the grant are to build community capacity and coalition capacity to affect substance abuse, it really made sense for us to really kind of grow that body. So as I said, the AOD Partnership of Old only had a few dozen members, and we've quickly grown. The second goal of that grant is to reduce substance abuse amongst youth and over time with adults. And from a public health perspective, the environmental strategies and community-based interventions that we do really impact our whole population. And our coalition's reach actually goes beyond just our target area, which is the WASA Metro. It consists of 5 different municipalities. There's on the screen right now, you can see that our focus area for our coalition really is between 50 and 60% of the total county population lives in that central part of the county. The median income, the race and ethnicity, home ownership, all those things really vary amongst those different municipalities. So it's really something to kind of pay attention to. And as you can see, we're located right in the middle of the state. And it actually is something that when you look at Marathon County as a whole, just to give you perspective, you don't have what the county looks like. It's the shape of actually what's in our logo down below. A little fun fact about Marathon County is that it actually has more square miles than the entire state of Rhode Island. So you can imagine that the 38 county board members can really make passing any policy on a county level very difficult at times. And our substance abuse problems are not like any others. Unfortunately, as you can see with the spot on the map, we're located on what's commonly referred to as the Highway 2951 corridor. It's really a thoroughfare of heavy, diverse, and lucrative drug activity between the Twin Cities and Minnesota, across to Green Bay, but then also the traffic that comes up from Chicago and Milwaukee. And we really are one of the main distributors in central and northern Wisconsin for a number of different drugs. It was clear that we needed a response to the issue of heroin, prescription medication, and other illicit drug use in our community. And we needed it quick because individuals, families, and systems were really under attack. I call this first section the revelation because the issue of substance abuse, specifically when we look at opiate abuse, and the way that the AOD partnership started to do business was going to be a new way for many of our service providers who are perfectly comfortable with really just sticking to raising awareness and holding workshops and trainings. So when I came in, we really kind of shook it up. Because when you look at the issue of substance it's not a simple problem. It's not even a complicated problem. Substance abuse is really a complex problem. There's no, one size fits all. There's no, one thing that we can do to really impact the problem. And this is a slide from one of the presentations we had locally here. It's actually a great representation. I don't take credit for it. I give credit at the bottom, but it's a great representation of how these complex issues really need a multi-layer approach. For those of you that aren't familiar, public health folks will probably recognize this right away, but it's the socio-ecological model. And it's really a helpful tool in describing the multi-level change that is needed to sustain the desired outcome that we're looking for to create community change. Take for instance, a duck in a dirty pond analogy. If you take the duck out, you clean it up, you nourish it, you bring it back to health, but you reintroduce it to the same environment, you can really expect the same results. In order to have sustainable change, we can't just work on the individual and those that are in their close circle of family and friends. We really need to look at what organizations touch them. We need to look at what the community is doing that's impacting their behavior, as well as looking at any policies, laws, the culture as a whole, and how that is impacting them. As a coalition, the AOD partnership really lives on those outer 2 to 3 rings of that model. But we really do try to provide a lot of support for those organizations that provide, those inner 2 rings. So how do we kind of get there? How did we really move forward? Collective impact is, the answer is collectively, but collective impact is a framework. I kind of look at it as coalitions on steroids. It's more than just simple collaborations. It's really looking at taking a dynamic group of individuals and organizations that are working towards a common goal, looking at systems level change to really improve the community. So, at this point, I just kind of want to do a poll question to see how many of you guys have heard of collective impact, that you maybe use it, because I think there's a lot of people that believe I've used it, and then you ask them really what it is, and they're like, no, maybe I haven't used it. So answers are coming in. Wonderful. So it's kind of a split, probably an even split. Wow. I'm impressed. And we've got a few that haven't heard of it. So I'm not going to claim that I am an expert by any means, but I'll try to provide a little bit more information on how this really does, how this kind of framework has helped us move policies along. Thank you very much for that. There's a number of actually, Stanford is the ones that have done a number of reviews on the collective impact framework. So I definitely would recommend the red cover that's down below on this slide is actually what I find is the one that works the best in our community. So that if I was going to suggest an overall slide, like overall handout for you to use, I would suggest that one. It's called Channeling Change if you can't read it. But there's also the Collective Impact Forum, which is going to be on the bottom of a number of these slides. It's another great resource that you can go to webinars. There's different studies and reports and chat rooms and all kinds of great information on there. So when you look at collective impact, if you don't have it, or if you're looking at these complex problems, there's a lot of the time, this is kind of what it looks like. And I'm sorry this is a little small, but this is actually an example of when you look at, childhood development. It's not specific to substance abuse, but you kind of get the point where when we're working in our different silos, unless we're coming together around a common goal, everybody kind of points a finger at everybody else. So I just always thought that this really represents it well, because we can look at any stage of the game and who maybe dropped the ball, and with collective impact, we really are all in it together. So at this point, I'm just going to show you a very short video. And again, you have the link there, and I'll be quiet and I'll explain it when we're done.
Collective impact. Diverse organizations coming together to solve a complex social problem. Traditionally, nonprofits have operated in isolation from one another, pursuing their goals independently. But complex, large-scale problems require a coordinated, structured, and collaborative approach. Collective impact means creating alignment, commitment, policy, funding, trust, and coordinating across sectors: public, nonprofits, business, governments, foundations. Collective impact efforts typically have 5 conditions. Common agenda. This means all parties agree to shared goals and how to get there. Shared measurement. Keeping track of the same things. Mutually reinforcing activities, each actor doing their own part, using their unique skills. Continuous communication, regularly sharing results with each other. Backbone organization, a support team that helps mobilize, coordinate, and facilitate to keep the goal in sight and the progress rolling. Channeling our collective strength, we can solve the world's toughest problems. Collective impact. Diverse organizations coming together to solve a complex social problem.
Okay, so as you can see, it's just kind of a great overview. So if you're not familiar with collective impact, it's a great way to kind of promote that to your community partners. But, when we look at the issue of substance abuse and what we've been doing here in Marathon County to address it, it really has allowed for us to establish, what is the common agenda? What are the things that we're working towards? We've been able to look at how we can ensure that we have shared measurements that are going to help us evaluate our efforts to make sure that we are making the biggest impact that we can. Looking from a coalition perspective, I believe that we always want to do some mutually reinforcing activities. You don't show up unless you're going to get something out of it. So I think it's the looking at how can we harness each individual organization's or each individual's strength to move us towards that common goal. I'm going to give some examples of all these 5 conditions, but one thing that I do have to say is that we need to have, in order to move change forward, you do really need to have a strong, capable backbone support to help those partnering organizations be a part of this and to achieve the other 4 conditions. But when I say backbone organization, and I'm sorry if this slide's a little fuzzy again, you can actually find this within that red article that I showed just a few slides ago. But backbone organizations, it's not one size fits all for your community. It's not one size fits all for the problem that you're trying to impact. And this can be used for any sort of social problem: education, early childhood development, hunger. It could be used for many things, but there's many different ways, there's many different looks that a backbone organization can have. But when you look at backbones, the functions that they provide, and I'm going to go a little bit more into how the AOD partnership has provided these functions. But you can see that there's really 6 things that The Greater Cincinnati Foundation and FSG, who's a leader in this initiative, in this framework, really identified as backbone functions. So if you're, part of a coalition, or if you're, one of those backbone organizations, our AOD partnership is a backbone organization with the support of staff from our local health department, as well as our wonderful, diverse 15-member board. We're all putting part of it, and we're helping to achieve these different functions. So when you look at the issues that we're facing our community, like I said, we are in an area of the state that we, if we could just pick up and move or put walls up and stop all traffic from coming in, would be great. But there's there's a huge demand. But, I think for a lot of those that have been working in prevention, public health, you name it, for, you've probably heard about Wisconsin's reputation for excessive alcohol consumption. We've been at or near the top in the country in binge drinking, self-reported drinking and driving, underage drinking, and overall consumption. And, actually excessive alcohol consumption has cost the state over $6.8 billion a year, which equates to over $1,100 for every man, woman, and child in Marathon County annually. It's a huge, huge issue in our community, but there is one issue that has really been infecting this community and has led to untimely deaths of a number of our teens, young adults, and so on, and that's heroin and prescription medication abuse. So the discussion around heroin, what our Attorney General calls the scourge of heroin, began inadvertently in 2012, in February, when we had a meeting on prescription medication abuse. We had just concluded a community assessment to measure the prevalence of medication abuse, and so we actually pulled together a panel of local experts to kind of look at its impact, whether it was law enforcement, whether it was treatment providers, whether it was our medical examiners, school officials, you name it. The word that came up, they said prescription drug abuse is important. We need to talk about this, but we need to talk about heroin. So as we began to pull data from our community partners, the trends were alarming. In 2010, we started to see a shift. In just a few years, we saw a marketable increase in overdoses, overdose deaths, drug-related crimes, instances of persons seeking treatment for opiate addiction, so much that our local medication-assisted treatment program went through a year's budget in less than 4 months. And we also saw a significant rise in hepatitis C and HIV related directly to IV drug use, especially amongst our 18 to 25-year-olds. Because those rates were so high, our area of the state became the focus of a study that was done by the State Department of Health. This does not even count the number of drug-affected births, out-of-home placements, school dropouts, and other ramifications and secondary traumas and secondary instances that heroin addiction had on our families in the community. It's estimated in 2013 alone that over $5 million was spent in Marathon County services just to react to the burden of substance abuse, including heroin and opiates. Prior to 2010, local law enforcement and treatment rarely, if ever, heard of heroin in the community. The biggest threats were similar to many other communities, were pot, was methamphetamines, and let's face it, alcohol. Lieutenant Gary Schneck with the Marathon County Sheriff's Department said, "We did not know the problem we had with prescription drugs until the reformulation of OxyContin in 2010. Within a week, heroin flooded our streets, and it hasn't left." The hardest hit group in all this are teens and young adults. Working against us is what I think is the perception of what someone that is using heroin or addicted to opiates, what they look like, or our ability to identify what youth are, quote, at risk, unquote, or developing substance abuse disorders. If you ask me, all youth are at risk. And let's face it, we knew we had a problem. So where do we start? As I already alluded to, coalitions are really good at 3 things. We're really good at providing information to the public. We're really good at building skills and having different trainings and workshops, and really good at providing support to our community partners. But we knew we had to go beyond education in order to impact this problem. We knew that we needed to look at some of those other components of CADCA's strategy, 7 strategies for community change. We needed to look at what, access and barrier issues there were out there. We needed to look at how we can incentivize or disincentivize different behaviors. We need to look at what's happening in the physical environment. that was causing some of these behaviors to take place. And we knew that we needed to look at our policies to see what needed to change. We also knew we needed to attack it from all sides. We knew that we couldn't arrest our way out of this problem. We knew that, this wasn't something that was law enforcement's burden alone. It was taking its toll on everything from property values to healthcare to schools, you name it. Prevention, treatment, and enforcement, and our harm reduction partners all needed to be at the table. And finally, addiction is an equal opportunity employer, and this drug was hitting every class, every race, every neighborhood, and more homes every day. We knew we had to both get people talking about the problem, but what I think is even more important was to move them to action and join some of our AOD partnership efforts. So how did we do it? How did we move the principles of collective impact into creating an initiative to reduce this problem? Well, our Pushback initiative is based on 3 basic key messages. The first, heroin, prescription medications, and other illicit drugs are a threat to our public health and safety. There's no disputing that. Second is that funding for prevention, treatment, and enforcement is critical because we can't, like I said, we can't arrest our way out of the problem. We need to make sure we have enough treatment for those that are seeking treatment, but we need to look upstream. How can we prevent our teens and young adults from even trying any of these substances? How do we alert those that are getting prescriptions for something like sports injuries or wisdom teeth or something like that in their teens about the highly addictive substances that opiates are that can lead to future heroin use? And the last message in this initiative was that we're all impacted and we all need to play part of that solution. On the website at the bottom of that slide is our website for the initiative, and you can actually see our entire marketing plan on there that was created a little over a year ago now. And so if you want to kind of look at it and see how we did things here. But when you look at the timeline of it, as I said, this did not happen overnight. This is something that grew for over 2 years now. It started in February 2012 with that discussion about prescription medication abuse. It continued as we continued to gather that data from our community stakeholders until we decided we had enough data and that we were going to pull together another panel of experts in August of 2012. It was the first time we ever talked about heroin. And prior to that, our coalition meetings probably had between 45 and 50 people there. And that was great turnout. At that meeting, we had over 80 people in attendance. It also featured some local young folks, which there's a picture coming up here that I will point out, some young folks that really put that new face on heroin, because if you ask people, they imagine, the PSAs in the 80s might have not done a whole lot to reduce some of the substance abuse, but they did give us an image in our mind of what someone that uses heroin looks like. And they actually put a new face on heroin. So out of that meeting, we started what we call here as our short-term action teams, or stats. And with those stats, we did some planning. We did some meetings. We looked at what key messages, which were on the slide before, do we want to have out there? What are the resources we need? Did a network analysis to see what are the who are the people that we need to have at the table. So in December of 2012, we got an early Christmas present from one of our wonderful local foundations who's very supportive of a lot of our efforts, the Judd S. Alexander Foundation. I got a call 2 days before Christmas with Melissa, what can you do with $20,000 to raise awareness on this problem? I'm like, I can do a lot, you can imagine. So we spent from January to April really creating this marketing plan, looking at how we can get the messages out there, what kind of things we needed to do. And in May of 2013 was the beginning of the adventure. 1 summit, 6 press conferences, dozens of meetings, hundreds of presentations, and countless media messages later. This initiative has really created a wave of movement that we just couldn't imagine. Some of the examples of how we built common agenda. I'm just going to kind of go through these a little bit just to kind of give you an idea of how we did this. How do we build a common agenda to get all of our participants on the same page? We held both public meetings, private meetings, through our press conferences. We actually identified a number of individual and personal stories that helped us make the case so we can link the data to some of those that are impacted directly by it. We did that network analysis to identify what key stakeholders were not currently at the table that we needed. We hosted meetings with local policymakers to build support through our public sector. And we also worked through the strategic prevention framework to ensure that all the strategies within the action plan that we were going forward, it was comprehensive, that we didn't spend all of our time just raising awareness, but we looked at some of the other things through assessment that we needed to implement. And the end result, when we were creating this initiative, we wanted to make sure that the theme was concise, it was unique, it was memorable, that it prompted active participation in the efforts to reduce substance abuse in the community. Just the image alone, the two red hands in the pushback position, it was itself a call to action and easily recognizable. And now this initiative has actually been used in communities throughout Wisconsin, and they're looking at it. As far as shared measurements go, with many community coalition efforts, evaluation is extremely important. So it was identifying that baseline data. It was looking at some of those desired outcomes. It was creating that dashboard as a ways to track progress towards our outcomes. We used shared measurements to identify existing data sources and what data gaps we had. We tried to create a plan to collect that missing data as well. And then we looked at our trends. We wanted to make sure we were open and honest, and there's really a lot of trust in that to share those measurements. But like I said, the marriage between the qualitative and quantitative data, putting that harder face on the initiative helped us build our support for the initiative, but it also helped bring in resources for prevention, treatment, and enforcement. Through our mutually reinforcing activities, we encourage shared learning amongst our partner organizations. We always encourage lessons learned. What are people learning within their own organizations, and how do we move forward? We try to share evidence-based and promising practices with our AOD partnership supporters. We've surveyed our memberships to make sure that we're not only on the level of engagement, but their satisfaction on the involvement. Because if people are not getting something out of it, they're not going to continue to be involved. We also provided regular opportunities for people to network amongst their partners, continued to solicit feedback and strategies to address the problem, maintained and tracked all of our in-kind contributions. And then, with this wide range of groups, we encourage them to design their own pushback type of initiatives and efforts to help support the cause. And with the continuous communication, the AOD partnership is really the gold standard, I would say, in the state of Wisconsin for the work that we do here. We send out a weekly update or a newsletter, electronic newsletter once a week. And it actually goes to over 800 people that we send it to directly, but it gets forwarded on to a number of different state organizations. But over 800 people throughout the state that receive that newsletter. And we average about 25%. For example, that open the newsletter on a regular basis. So through our continuous communications, we were able to build relationships with our partners to help looking at their missions and how they fit into our objectives. We identified barriers and looked at preferred methods to share information amongst our partners. We looked at regularly assessing them through our projects. At every meeting, we do evaluation because we're always continuing to get feedback to make sure that all of our communications are open and honest. And using a tool like Constant Contact to do our updates has really helped us track our effectiveness at that. Through this initiative, there's a number of community sectors that have contributed to the success. And there's two that really stand out. Here you can see, our media, without our media support, we would not have been as successful as we have. You can see some of the headlines, some of the stories. And as I said, this first meeting on heroin, let me see if my little arrow shows up here. Oh, it's way over here. Maybe not. I was going to try to draw an arrow for you. Oh, there it is. This story here, these two, this is 2 years old now. People still remember this City Pages cover. It's a weekly paper. So we've got weeklies, we've got dailies, we've got business, we've got TV doing different series, we've got radio doing different series. Without them, we would not be as successful, like I said, as we were. Also our businesses, whether it was promoting the medication drop boxes, whether it was helping us separate our medications that we've taken back, and Kinsey Green Marketing Group is the brainchild behind the Pushback Initiative. They've donated minimum dollar for dollar of in-kind contributions. So they are over, in the tens of thousands of dollars that they've contributed back to this effort. So we've really been very, very fortunate to have our businesses working with us to help us move this initiative along. Some examples of some of the additional sector engagement. If you're not familiar with the 12 sectors of the community that's referred to in the Drug-Free Communities Grant, here's just some examples of how the different areas of the community have really joined together and have helped us in one way, shape, or form. So when you look at the kind of the breakdown to sum up, with this initiative, we've been able to engage our local media. They have been phenomenal in us getting this effort out. They have been a great partner. They have been instrumental in us raising awareness on this issue. We've also been able to utilize our networks. It's kind of that we all don't know someone we need to know, but we all know someone who knows someone we need to know. I often joke that I've got a guy, I know a guy, because through this initiative, our network has grown exponentially. The people that are connected to this group, that have been connected to the coalition, have really come together around this issue, and it's really helped us partner and move things forward. We've also, with this buzz that was created, people have been coming out of the woodwork. Stories that we've been hearing from families or individuals that have been impacted by addiction. In meetings where we usually have 45 to 50, we are now pulling in 85 to 100, if not more. People are really concerned about this issue, and they're ready to get involved. Also, the Have the Presentation will travel, whether it was a civic group or community group, businesses, churches, neighborhood groups, policymakers, you name it. Everybody wanted the information and wanted to get involved. It also allowed us to get some sponsorship opportunities. I'm going to show you a slide coming up here on the next one. That's kind of our pushback swag, I like to call. It's a lot of the materials that we've created. We've been able to find sponsorships, whether it was our local Crime Stoppers sponsoring the printing of our How to Identify Drug Activity and How to Report It bookmarks, or our information on treatment being sponsored by one of our local treatment providers. We've been able to find sponsorships for people to help pay for a lot of what we've been doing, and that's been very fortunate. And also the neighborhoods, the neighborhood engagement, community members that they're concerned about what's going on. They think they see things, but they're not for sure. Giving them the tools that they need. Just some examples. Our pushback swag is kind of in the backdrop there, but we've had volunteers going out and going door to door and distributing these materials. We've had community members contact us and say, we want to do something. The one in the lower left was actually, it was a garage sale. It was a big city-wide garage sale, which is a big deal in Wisconsin. I don't know if it is everywhere else, but they wanted to make sure that we were at that booth and sharing that information with the thousands of people that come and attend that on the weekend. So we've been able to distribute probably over 3,000 bags in our community in the Wausau metro area now. So are we making an impact? That's the million-dollar question. When you look at collective impact, I didn't realize this was come up this way, but when you look at kind of the collective impact, we know that we have to look at it at multiple levels. So you need to be able to track both your process and your problem outcomes. So when you look at it, you need to gather the context of the initiative. You need to look at things like in the community, the culture, the demographics. You need to look at the initiative itself. You need to also look at the systems being impacted and the initiative's impact on the population as a whole. So I'm just going to give you some examples of kind of what we're looking at. But when you're looking at gathering this context, I definitely cannot say enough that you need to do your homework. I think it's important when building the case for initiatives such as Pushback that you're able to set the table with a strong argument, kind of providing that why or the context. And some of the useful tools that I'm sure you guys have heard of, the SWOT analysis, looking at strengths, weaknesses, opportunities, and threats to your initiative. I also think that the PEST initiative, which not everybody's as familiar with, and that one really stands for political, economic, social, and technological factors that may be impacting our capacity for collective impact around this issue. They're all important. All those different assessments are important to building that common agenda. And when you look at the initiative itself, I pushed the wrong button. When you look at the initiative itself, and going back to that backbone organization, again, this is an image that comes out of Greater Cincinnati. This is just some examples of how we as a coalition are looking at, have we been able to go through and check the boxes next to those colored boxes on the left? How do we measure that partners are able to articulate their role in the initiative? How are we showing that community members are increasingly aware of the issues? How are we showing that funders are asking nonprofits to align their initiatives? How are we showing that? So that's all that is all pieces of that process outcomes. It's all things that, when we look at moving this type of initiative forward, that you need to take in mind. Some of the community engagement important points I think to point out are, with our community engagement piece, like I said, with some of that neighborhood outreach, we've had over 30 volunteers distributing to over 12 neighborhoods. We've raised, this is an older slide, but we've raised well over $2,500 in donations to help support that outreach. We've distributed over 3,000 bags going door to door. Some of the things related to prescription opiates that are obviously directly linked to heroin is that we've collected now probably about 3.5 tons of medications at our permanent drop boxes. We have 5 locations here in Marathon County. We have distributed probably nearly 20,000 drop box cards at this point. When we looked at our community assessment on medication abuse, we did ask how many people were aware of the different drop box locations in the county, and we've seen an increase just in 2 years, just based on some of our initiatives, not only the Pushback initiative, but some of our coalition initiatives as well. And we have 100% of pharmacies, about 3/4 of dentists, and 2/3 of churches participating in the promotion of that program. I think one of the biggest things when you're looking at community engagement, one of our proudest data points, is the fact that we wanted our everyday citizens to be working with law enforcement to identify drug houses, to call in tips. And we actually saw over 230% increase in calls to the Marathon County Crime Stoppers, which is our local anonymous tip line, since the Pushback launch. Over 230%. So they had 38 the year before, and they went up to 89. Some of them are big scores too, tens of thousands of dollars in drugs that have been turned over as a result of some of those calls. Another one of the objectives was to raise awareness on the problem and get people concerned about it. So when we looked at compared data, some different data points here, but the colored data on the top is actually from our community assessment that we've done on prescription drug abuse. But we actually asked them, is the use of illicit or illegal drugs a concern? And you can see between 2011 and 2013 that the cause of concern has more than doubled. That's definitely significant. Same thing with the abuse and misuse of prescription drugs. The level of concern has gone up. And the data below is actually one of our community surveys that our local United Way partners with a number of people to perform. And you can see there as well that the concern has definitely been going up, thanks in part due to a lot of the media, but also some of the education that we've been able to do in the community. The slide's a little bit skewed, but you can see here again the perception of prescription drugs versus street drugs. Which one is safer? You can see that there's more people that strongly disagree with that fact. You can see a shift in the culture. You can see a shift in the level of concern and the awareness. Same thing with when you look at it's okay to take more medications than prescribed. You can see people are more aware that that is not an okay behavior. So it's just some of the data points that we the goal of this again was to raise awareness, ensure that we had enough funding for prevention, treatment, and enforcement, but then also to get the community involved. From a coalition process standpoint, this initiative has raised our brand awareness. More people know who we are, what we do, what we're about. As far as a coalition, they also recognize the logo and they see ways to get involved. We've also increased overall awareness. As I said, with those last few slides, we've moved that needle. We've also been able to collect a lot of local stories. The marriage between that qualitative and quantitative data has been really what has really put the face and put the heart in the initiative. Our partnership with our different partners has gone up greatly as well, not only in meeting attendance or newsletters, prescribers, but when you look, or subscribers, excuse me, you look at the partnership with our faith-based organizations that, and it goes into the local and state funding. Because of this initiative, we've opened doors to not only new partners, but also new funding. One of our local churches supported this initiative with $2,000 And that's a lot for one of our local churches to put into it. The State Department of Justice identified us as a leader and wanted us to be part of 5 different communities in the state receiving a grant to work on the issue of heroin. We also received that foundation funding amongst other littler foundation and other personal donations. And the interest on a state and local level has gone up to whether it was being part of some of the statewide task forces that have been launched, whether it was participating in the Service to Science project this last year. This has really helped us as a coalition build perspective and build awareness. Just a few slides left as far as lessons learned. Obviously, the addiction stigma, it's a daily struggle. It's something that, we have folks that want to get involved or want to tell their family story, but they're not for sure how their loved one may be treated. It's something that we continue to work with every day. The challenges of funding with the Drug Free Communities Grant ending at the end of September for our community, we're looking at how do we continue these initiatives as we go forward. The demands on time by all of our volunteers is always going to be a problem. When I have head of the snake in there, that just means we take one low-level dealer out who's usually dealing because they need to support their habit. We take one out, 2 takes their place. The lack of treatment options, especially when we look at our youth. We did have an inpatient treatment for those that need to be medically detoxed that was located within an hour travel from here. That closed, shuttered its doors last year. So now people have to travel a number of hours, youth even farther. Unless you have thousands of dollars up front, there is really no treatment option when you look at the issue of heroin and opiates if you need something more than outpatient or medical assisted treatment programs like through methadone or Suboxone or Vivitrol. And then that power of perception. We know that we can't just put out there, everybody's doing heroin or everybody's abusing their prescription medications, because that's not the point. So we're not really focusing on that. We're focusing on the fact that we all need to be part of the solution. We can't sit back and complain about it or sit back and throw our hands up. We need to really start looking at how we can raise participation. On the horizon, like I said, we were participating in the Service to Science. It was looking specifically at how effective we are with collective impact. We're still working on some of the evaluation components with that. We were nominated to take part in the National Prevention Network's exemplary award process, as well as CADCA's Got Outcomes. While we weren't chosen for those, we know that this is a new initiative. There's plenty of research that needs to be done yet on it, but we're really excited about where we've gone. We're going to continue that outreach to continue to engage like schools and businesses and other municipalities, which is just a start in this initiative. We want to look at expanding our programs here. Like I said, we are in a treatment crisis here in this county. We want people to know that they can lead healthy and productive lives if it's bringing in transitional living facilities, bringing in transitional work sites, learning from others in our community, and also expanding on our very successful OWI court to be able to form a drug court here to hopefully serve youth and adults alike. Take Back Youth is one of our new initiatives to connect parents to information they need when they need it. It actually came out of the work that we've been doing in the Pushback initiative, because more and more parents have been coming out and persons that are working with their loved ones that are looking for that support. And when you have a youth group, when you have a group, a lot of the times you're in crisis. When you're not in crisis, you don't come anymore. So we're looking at how we can create this environment in an online forum. And again, continuing to evaluate, looking at our youth risk behavior data, looking at repeating our community assessment, and continuing to kind of follow those collective impact measurements. I do want to point this out because I don't know how many people outside of Wisconsin have this or know of this. The State Council on Alcohol and Other Drug Abuse, which is commissioned by the governor's office, created an ad hoc committee to create a list of recommendations for prevention, treatment, enforcement, harm reduction, and businesses. It can be downloaded on our website. There's a screenshot of the new report. There's also one on 911 and Good Samaritan laws looking at overdoses, overdose and overdose deaths. So, we know that there's things out there. We know that, this is not something that we're dealing with alone, but, hopefully some of this helped you all kind of see how we've been addressing it. And, I think at this point I'll stop and ask for questions.
Great. Well, thank you so much. That was a very informative, fantastic presentation. We do have one question already from Scott Leveridge, who's our director here at the North Central Regional Center for Rural Development and the director for the CAPE project. So he says, I was intrigued by the law enforcement statement about the speed at which the heroin problem arose. So what systems might help people learn about emerging problems more quickly?
Well, and I think that kind of came down to, if you establish shared measurements early to look at those trends, to share that data, when they reformulated that, I knew a number of our local law enforcement partners, which Lieutenant Schneck actually, he heads up that unit, that were part of that drug unit. Same thing with our district attorney's office. Same thing with our medical examiner's office. They weren't seeing the sheer amounts of heroin coming into the community. They weren't seeing the overdoses. They weren't seeing those data points that would really trigger, hey, we need to pay attention to this. It really was, that shift in late 2011 into 2012 when we first started that discussion, because it was our local treatment provider, the medication assisted treatment facility. It was them. They only had really was prescription opiate abuse. That's what they saw. And then when they, as that was reformulated and as prescription medications were less and less available, people were going to heroin, which is cheaper, which was easier to find, which was a stronger, maybe not longer lasting, but the high of it was more readily available. And like I said, same thing with the overdose deaths. In our overdose deaths, we've seen a little bit of a leveling off, but we've also seen an increase in the use of Narcan, which is the anti-overdose injection in our community. Without that, a lot of our data would be continuing to spike and continuing to go up. And if people want to see some of that specific data, I can definitely shoot me an email, let me know, give me an idea of what kind of data you want. But there's a couple different things that the county administrator had pulled together as we prep for sustaining some of our efforts going forward. I can get you some of that data. You can just see that the trend was just amazing for issues related to that. It was very quick for our community. It was very quick. And again, it has a lot to do with where we lived.
So have you seen, from some of the data that you have available or from hearing from law enforcement since the start of the Pushback initiative, that there has been a decrease in heroin use or substance abuse?
What we've been seeing, and we actually, when we created, one thing I should have mentioned with this, when we created this initiative, we knew that heroin is the issue that's impacting us right now, but we also knew that, we can't put all of our focus on one drug, because when one focus goes on one, another one pops up. And heroin has been our example through this initiative, but methamphetamines is another one that has really risen. As far as trends, is it being used more? I think so. The more that we keep, I mentioned how much our drop boxes are used. The more we continue to decrease access to those, the more our prescribers are not over-prescribing or not sending people home with 30 days when they come into the emergency room. They're sending them home with 3. Looking at some of those policies that could be put into place, the more heroin is alluring. But our numbers are still startling at the number of teens and young adults. I've heard of people as young as 14 starting using injectable heroin. So injectable is definitely more common in our area compared to other areas of the state. There's other areas of the state that do more of the snorting of heroin, but we do have the IV drug use of heroin is higher in our area, from what I'm told.
Thanks for sharing that. It looks like we have a couple more questions. D. Owens was wondering about contact information, so we've switched the slide over. Melissa's phone number and email address are there. And we have a comment here and a question from Deborah Bolton saying that she thinks people have to be interested in current affairs and communities, and that helps with information. And she asks, how do we teach those who are disconnected?
Well, and I think that comes down to that network analysis, because finding the people that people listen to. It seems simple, but one of the persons that has been one of our biggest allies, is the CEO of the Judd S. Alexander Foundation, the foundation that funded the creation of this initiative. Finding the people that are connected is a great way to get those that are disconnected. The people that boots on the ground, sometimes we miss things. And I think that that's important as well, as to connect those that are in the muck, bringing in social services to sit next to our probation and parole, to sit next to law enforcement, and bringing in our schools, and bringing in administration and hospital systems, and really collective impact allows you to bring in all the different people that are working in your community. That framework, it's not like it's a prescriptive program, but that framework really allows you to bring people together around this issue. And that's really what's helped us. And, if there was one, presentations are a big thing. If there's one group to present to, is your civic and community groups, because they are consistent of, you have faith-based, you have business, you have media, usually those are made up of such a diverse group of people. By going to one meeting of those type, Optimus, Kiwanis, Elks, Rotary, all those that are youth focused, could also increase your funding streams as well, and they could be sponsors. I think that the more that we could put the face on it, the more that people are talking about this issue, the more even people that, and I just see your comment there, Deborah, the more we can point out of how this is impacting them, even if they don't know anybody. And that was part of that. That's why we had that third part of our key messages, is that we're all impacted by this. So even if it's your property values, even if it was calls for service for law enforcement, even if it was, health insurance, the strains on all of our systems is absolutely astounding. We had no idea until the county administrator started pulling all the data from just our county systems, how much it was actually costing us to address the issue of substance abuse in our community. Like I said, that's something that has been very effective in us getting the attention of our policymakers, not only on a local level, but on a state and federal level as well. I think that some of the best ways to find out what issues they are seeing, because they might not see that. Our Western Marathon County, like I said, it's huge. When they looked at the issues that are impacting them, they have more cocaine problems out in Western Marathon County than they do heroin. It comes down to what is available, who's out there, who's moving the product. We have a lot of Mexican immigrants that come in to work out in the farms, in the factories out in Western Marathon County. They also have very close ties with the cocaine trade. That's a big draw on why there's more out there compared to what's happening here in the Wausau metro area. And I don't think that it needs to be shocked. And that's where having the data along with the stories, finding that story in your community that's going to make a difference, engaging your local media, meeting with your editorial boards. And so they know who you are as a coalition or an effort and what you're about. The first time you meet any prospective funder, someone that you're looking for support for, should be a handshake, not a handout. Building those relationships early, showing up at their meetings, giving them regular updates has benefited our community. So hopefully that helps, Deborah. It's all about relationship building.
So you mentioned that in the beginning that there were efforts to pull together a bunch of data about different issues in the county to show the effect, that it really was a public issue that affected everyone. Could you give some examples of some of the data that were pulled together? You mentioned something about property values, but what other types of data might be useful in really building a case to be able to engage community leaders from different areas?
Well, I think it's looking at people care about what their tax dollars are going for. So looking at what is publicly funded, how is it impacted specifically around substance abuse? Is it, how many OWIs have happened? How many overdoses? Looking at having a variety, but it's not I find it more important almost that it's not the coalition that's the one that's sharing that information. It is the experts in it. We actually, through our press conferences for this initiative, we were very intentional on how we laid them out. The first one in May of 2013, and these are all available on our YouTube channel. We have press conferences that we held through AOD. We had one that was in partnership with the Department of Justice. And then we had a summit that we just had a few weeks ago. All those are available on our website around this issue. So I suggest you check those out. But, we raised awareness on the scope of the problem first and looked at, what are some of those areas in the community that are impacted by this? And we continued that. Our heroin summit that we just had, we invited people that haven't necessarily had that public voice. So it wasn't just the prevention people talking. It wasn't just the treatment people talking. It wasn't just law enforcement talking. It was looking at all the different sectors that had been impacted by it. So it was very clear that, this isn't a law enforcement problem. This isn't the DA's problem. This isn't, treatment, mental health and substance abuse treatment's problem. This is all of our problems. This is how it's impacting all of us. And I think that that's really helped build a lot of support for the effort.
Thanks for explaining that. I don't see any more questions, but I will give just another couple of seconds here in case people are thinking.
Yeah, as people are thinking. As I said, check out if you go to the aodpartnership.org website, you can get a link right to our YouTube channel. You can see some of the things that we've had. We record all of our regular meetings. We've had 2 meetings now specific to heroin that are also recorded that are on there, and some of our other meetings too. So if you're interested in alcohol, if it's in impact on the brain, all those, there's a variety of different topics that are part of that. We've also got a great one on methamphetamines and bath salts that I would plug too. As far as are the police the first to notice, I would say our special investigations unit would probably be right at the top for sure. But then you also have to look at who when there's arrest or there's an overdose, who else noticed. Our EMS, for example, also very, very clearly, very quickly became aware of the issue. And at that point, they actually, in the state of Wisconsin, you had to be a higher level paramedic to even administer the use of Narcan. So we were having a lot of problems around that. Our medical examiner as well really did notice the problem early. I would say even now, all of our law enforcement officers are not necessarily on the same level as our special investigations unit. And as far as people working with troubled youth, again, all youth are at risk, but our youth serving organizations are very much in partnership with us. Our restorative justice, which helps our kids that have to do community service, are very involved with us. We have definitely engaged the entire community in this initiative.
Where would you say those organizations that are working with troubled youth would be in terms of seeing a new drug problem in the community? Are they some of the frontline people who would see that first, or what do you think about that?
Well, we've got a couple of people that do presentations in schools or work through Department of Social Services that have the youth that are referred. I would say that our youth that are in those programs are not as impacted under the age of 18 as those that are hitting 18. But some of our other new drug trends, absolutely, they're the ones that are on YouTube and everywhere else that are getting the new drug information sometimes before even we do.
And we've got another question here of how do you deal with outdated data?
Well, we look at what that data is, how it's collected, and then I know that we're running out of time, but we try to update our data regularly, especially to look at trends. If we don't have it locally, we look at what state data is out there, but state data is usually much more outdated than our local data is. But, as a prevention coalition, we're definitely going to keep looking at our youth risk behavior survey data and encourage our schools to participate in that so we can get an idea of how much we're moving the needle on people even starting using those drugs.
Well, it looks like we've hit 1 o'clock, so I think that we're out of time, but I want to thank you again, Melissa, for this fabulous presentation. It was very informative, and I want to thank all of our participants for joining us today. This webinar has been recorded, and it will be posted on the CAPE website at healthbench.info if you know of other people who may like to view it later. So thanks again, and I hope everyone has a nice afternoon.